The Symposium for Integrated Health and Wellness welcomes to the Harvard stage Dr. Emile Allen.
Well, good morning. Good morning. I have a question for you. If you could be able to have a solution to manage chronic pain without the use of any narcotic medications or medical interventions, would that be useful to you? Yes. Absolutely. I hope you'd say yes, because that was one of the most difficult things that I had to manage when I was in private practice as a urologist, is managing chronic pain. Conditions that I worked with were stuff like interstitial cystitis, which is overactive bladder, to chronic prostatitis, chronic orcalgia, and flank pain. Those patients that would come into the emergency room at 2 a.m., with pain in their back, and we didn't know if it was a kidney stone or if it was a drug seeker. Now, a lot of these patients that would come in to the emergency room or they would come to the office, they were bounced back and forth between primary care, surgeons, psychiatrists, and they had tried a multitude of medical interventions, sometimes some holistic interventions, and nothing was giving them any relief. And it led me to ask the question, why? Why are they having so much difficulties getting rid of their pain? Because I started to think, what is the difference between someone who has acute pain that's due to some type of a surgical trauma, because any surgery is a trauma, right? So it's due to surgery, or if it's due to a trauma that happened exterior and outside, like a car accident or falling off of, off the top of a roof or something like that, versus a patient who has chronic pain. What's the difference? What's causing them to have so much difficulty where they cannot get rid of their pain, whereas with surgery, their pain's gone in a few days or a few weeks? So it struck me that I can perform some of the most invasive operations on a person, such as a radical prostatectomy, a retroperitoneal lymph node dissection for testicular cancer, or taking out someone's bladder, where I make an incision, a 12-inch incision in the lower abdomen, remove the bladder for invasive bladder cancer, reroute the entire urinary tract using a piece of bowel and make a continent urinary diversion. And by post-op day number 10, the patients are no longer asking for any pain medications. And most of them, by post-op day number 6, they stopped taking their narcotics. They actually stopped taking their narcotics. So it really was quite interesting to me to how this was happening. And, whereas on the flip side, the chronic pain patients that I would see in my office and then I'd hear from the other physicians, those patients were begging for their pain to stop. And their pain was unrelenting, and most importantly, it was real. Why? I kept asking this question over and over again, and it wasn't until I asked this question one day, and the gods above gave me the answer. In 1998, I was operating on a patient, saving this woman's life, and I was removing her kidney, and there was a malfunction of a piece of medical equipment in the OR, and I was electrocuted. I was literally thrown back about 6 to 8 feet, had a seizure, collapsed on the floor, had a seizure, and I died. Luckily, because it happened in the operating room, my OR team was able to save my life. My patient went home in 3 days. I was in the intensive care unit for over a week. Okay. I ended up with seizures, a traumatic brain injury, and a significant injury to my left upper extremity, especially my hand, from nerve damage. And it took about 3 years before I could count change or read a book. And the pain and the injury that I had to my arm, the muscle atrophy, finally started to regain. And just when I was starting to get better, then I had another trauma. My dad was diagnosed with metastatic lung cancer. And it was stage 4, very poorly differentiated. and they gave him about 6 months to live. Well, we kept Dad alive for about 3 years, but towards the end of his life, he had lost so much weight. He went from like 185 down to about 115, 120. And in order for him to get around, sometimes we'd have to pick him up because he was so weak. And I thought that I'd injured my right shoulder. And the pain was, you know, just kind of this nagging, aching pain. But then, after my father died, it got to the point where I could not lift my arm above this level. Then when my dad passed away, the pain got so bad a few months later that I needed to go see an orthopedic surgeon. And the orthopedic surgeon examined me and he said, "Emile, I think you have a rotator cuff problem. I want you to get all these x-rays and this and that." And I said, "Well, just let's hold on for a moment. I need to go to this personal development course. It's already scheduled, and I'll get all the tests and things that you want me to do when I come back." So I go to this personal development seminar, and unbeknownst to me, I didn't know that they were going to do group hypnosis at this event. And during the group hypnosis, I actually had this huge grieving over my father. And when I finished grieving during this event, it was only, gosh, the hypnosis session was probably only 30 or 45 minutes. All of my pain in my shoulder was gone, and I was able to lift my arms up with no problems at all. And the pain that was in my left upper extremity from my accident from, gosh, at that time when this event happened, it was almost 8 years later, this pain had significantly improved. And it struck me, it's like, how did the hypnosis do that? What was going on with my body that made me react that way? And it led me to realize that chronic pain is always associated with a negative emotion. Always. Chronic pain is always has a secondary gain. Always. Whereas acute pain is not associated with a negative emotion. Acute pain is not associated with a secondary gain. And as I mentioned earlier, most patients after surgery will stop using their narcotic medications around post-op day to 6. If any patient goes beyond post-op day number 10, post-op day number 6 to post-op day number 10, if any patient has any pain beyond post-op day number 10, you better pay close attention, because acute pain can turn into chronic pain just like that. And then also, when that acute pain turns into chronic pain, their chance of becoming addicted to narcotics, if they're on narcotics, or they're going doctor shopping, then that risk goes up exponentially. So this observation that I noticed, it gave me an explanation of why chronic pain comes and goes, changes location, changes in intensity, and changes in character. It's because the chronic pain is associated with emotions. As emotions change, so does the characteristic of the pain. We see this in football players where they're on the field and bam, they get hit, and they twist their knee, but they're still able to finish the game. Or they get a concussion, and you hear about quarterbacks getting concussions, and they finish the game. Second reason explains why chronic pain happens is because why chronic pain is so difficult to manage or resolve with traditional medical interventions is because the patient is getting a secondary gain from the illness that's causing the pain. Like they're receiving attention from a spouse that maybe they're getting to the point where they're getting ready to get a divorce. But all of a sudden they get sick, the spouse stays to take care of the person, and so the patient's like, well, subconsciously, I'm not going to get better because my spouse will stay with me if I don't get better. This is happening at a subconscious level, not a conscious level. They're not aware of this consciously whatsoever. They may have secondary gain by avoiding a stressful situation at work. bullying, sexual harassment, bad boss, something like that. Or maybe they're receiving some type of workers' compensation or some type of other income. And the third reason drove me to develop a drug-free pain management process that I use with utilizing hypnosis. And I use it in the patients that I work with in my practice, seeing chronic illnesses and working with chronic pain patients. Now, some of you might be saying, well, gosh, this is really interesting and I'd love to do this kind of stuff, but the problem is I just don't have the time. I mean, I only have like 10, 15 minutes to see a patient and there's just no way. So I'll just send them to the psychiatrist and have them see them. And I'm telling you, no, don't do that. Because if you do so, one, you're losing untapped revenue that I'm going to show you how you can see patients and actually make more revenue for your practice while you're helping improve the quality of life of your patients. And you're sending the patient down the rabbit hole, meaning that you're now sending the patient to another specialist. And then that doctor is going to send to another specialist, so they're getting bounced around. When patients don't want to be bounced around, believe me, I personally experienced it. When a patient comes to see you, they want help. And they see you as the expert, and the reason why they made that appointment is for you to fix their problem. And if you don't do it, then you're just contributing to the problem. And the thing is that even though what your previous experience with chronic pain may have been, I'm telling you that this is an easily treated problem in regards to doing this within a 20-minute office visit. You might need a couple of office visits or a few more, but you can work with these people within 20-minute time periods. And I'll teach you how to do that. Now, as I mentioned, I'm a hypnotist, and we use hypnosis in order to work with people to help them with chronic pain. And what you may not realize is that you're already a hypnotist. You're using hypnosis every time that you see a patient. It's just that you don't know, you haven't been formally trained in that process to use it appropriately and effectively for patient care. Medical hypnosis is not new. It's been around for centuries. Started back in the 19th centuries, and physicians were the ones who actually started using medical hypnosis for patient care. They were doing a lot of research. It was backed by clinical studies all up from the 19th century up to today. If you do a PubMed search, you'll see lots of research on medical hypnosis for the use in all types of medical conditions such as Crohn's disease, stress and anxiety disorders, headaches, various treatments for helping patients with cancer and helping with the side effects of cancer, and then also with patients with pain. British Medical Association, the American Medical Association, the American Psychological Association, NIH have all approved and recommend hypnosis as a treatment modality. And if you're scared or wondering, well, how am I going to be able to use this in my practice? Don't worry, I'll teach you how to do it using hypnosis. So since you already are hypnotists, and all physicians are hypnotists, what is hypnosis? Well, there's a lot of definitions. You can look it up, and there's just tons of definitions, but I created my own definition because I think that this is the most accurate and especially applies the most directly for physicians. Hypnosis is an inwardly focused awareness used to bypass the conscious mind of the brain in order to access the subconscious mind that's running the physiology of the body. If you look at it this way, if you can talk, if you can pass an exam, then you can go into hypnosis. Everyone goes into hypnosis every single day throughout the day. The hypnosis is a natural state. There's nothing that you haven't done in your life that hasn't involved hypnosis in one way or another. Matter of fact, your very first hypnotist was your mother. when she held you in her arms as an infant, rocked you, and sung a lullaby. She was placing you into hypnosis. Now, hypnosis is not sleep. A lot of people think, well, you know, they're going to put me to sleep. Well, yeah, hypnosis will use the word sleep in order to guide the person into hypnosis, but it's not sleep. You're actually at an increased sense of awareness. Whereas sleep, you're not at an increase, or you do not have an increased sense of awareness. And any of the myths and misconceptions surrounding hypnosis is just Hollywood's portrayal of hypnotists in order to improve their ratings and show like it's some type of magical powers or anything like that. That's not the case whatsoever. No one can be hypnotized against their will. Hypnotists cannot make someone do anything that's in violation of their morals. The person must be a willing participant, and all hypnosis is self-hypnosis. The hypnotist, or you, the physician, is just simply there to act as a guide. Now, the reason why I stress that physicians are already hypnotists and that you're hypnotizing a patient every time that you see them is because whenever a patient comes into your office, they are highly associated with their problem, with their condition. And when a person is highly associated with a problem, and then there's an authority figure, whatever that authority figure says bypasses the conscious mind and goes right into the subconscious mind. And if the subconscious mind accepts it as being true, then it will become a reality for that patient. So I always tell doctors when I'm training them that you have to be careful of what you tell a patient. Because if you tell a patient, oh, you only got 6 months to live, and the subconscious mind accepts that, well, guess what? That may happen. You can equally give a positive outlook, and the subconscious mind can accept that, and the patient will do much better. That's what I actually did with my father, is we negated all the things that the doctors had told him about 6 months. We kept him alive for 3 years. Now, I'd like to share a few case studies with you in order for you to have a better understanding of how this works. I had a golfer who he was involved in a car accident, and he badly injured or fractured his ankle. And he came to see me because when he went and had surgery on the ankle, the surgeon said that it would be a few weeks for his pain to go away and about 6 months for him to get increased mobility of his ankle again after he got out of the cast and things like that, and then he'd be back golfing. Well, that didn't happen. It was 2 years later. The guy still didn't have a good range of motion. He wasn't able to play golf. His pain level was around a 6, sometimes up to a 7 out of 10 on the pain scale. And it was affecting his quality of life. So he came to see me, and I used my drug-free pain management process with him, and within about 20 minutes, we got his pain down to a 0. He had increased mobility of his ankle, and to this day, it's been 5 years, he's still pain-free, and he's out playing golf, and he's not having any problems. Another client that I had was a marathon runner, and she also was a salsa dancer. And she, over the years of doing all these marathons and dancing and other things, it took a toll on her joints. And she went in to see her doctor because she was having 6 out of 10 pain in her knees. And the doctor, orthopedic surgeon, suggested that she have bilateral knee replacements because she had such degenerative joint disease of the knees and loss of the cartilages. She didn't want to do it. She didn't want to have surgery. So she contacted me, came in, and worked with her. We worked with her for 2 sessions, 2 20-minute sessions. Within that second session, her pain level went down to a 0. And it's been 4 years now. She is out doing salsa dancing. She's not doing marathon runs anymore. but she's salsa dancing now, she has no pain, and she still has elected not to undergo the bilateral knee replacements because she's doing fine, she's not having any pain. So how would you like to be able to have some results like this? Would that be good for you if you got results like this? Yeah. Absolutely. And would you like to provide another option besides just prescriptions and invasive interventions for your patients? Yes or no? Yes. And would you like to have a new treatment that you can bill through insurance companies and know that you're going to get paid? Yes or no? Yes. All you have to do is just learn how to do this work, and you'll be the hero. You'll be able to help improve the quality of life of your patients. So I created this drug-free pain management workshop for healthcare providers. I work mainly with primary care physicians and their associates and chiropractors, but any physician that would like to do this, I welcome them because this is such important work for people to learn how to do. You can easily minimize or resolve pain, quickly implement this new skill set into your practice, and recoup your training investment in as little as 2 weeks after the workshop. And during this workshop, I promise to you that I will teach you proven hypnotic techniques to manage chronic pain, the role the subconscious mind plays in the chronic pain cycle, and how and why acute pain becomes chronic pain. How I find the true root cause of chronic pain and what I do to resolve it. How to identify and effectively manage the secondary gain that patients get. How to perform the most effective, rapid, and instant hypnotic inductions that work in every clinical setting. I've used hypnosis in emergency situations. I've been on a plane at 35,000 feet, and I've had to use emergency hypnosis in order to help a person having a panic attack. I was on a boat 2 hours off the coast in Mexico, a scuba diving boat, and the person, after her dive, got the bends. She was in severe pain and showing neurological deficits. I put her into hypnosis so that we could keep her calm, keep her pain level down until we could get her to a hyperbaric oxygen chamber. I'll show you how to quickly and effortlessly teach self-hypnosis to your patients for post-op pain management, chronic pain management, and to reduce the side effects from cancer treatments. And how to create new streams of income from your existing patients. How to create new streams of income from pre-op evaluations that guarantee at least 3 extra office visits per patient. So you do the math, see if it works for your practice. And how to be paid through insurance or with cash, it's your choice. So if you want to come to this workshop, it's just a 3-day weekend workshop. Click the link and register today. You'll become the expert. You can now be the change, and you can end the pain cycle. Click the link and register today. Any questions?
What role does emotional intelligence play in your...
Emotional intelligence?
Yes.
So you asked the question, what role does emotional intelligence play in what I do? Well, first of all, I would need to have a better definition from your viewpoint of what emotional intelligence is, because I know what my definition is. So what is your definition?
I guess I'm talking about the therapeutic model where a patient or a patient is extremely focused on their emotions and can identify them in their healing process.
Okay, so you look at emotional intelligence as the patient is identifying their emotion in their healing process. Well, as a hypnotist, I don't want to know so much or I'm not as concerned about what the patient is telling me in regards to what they think is going on. And it's not that I'm dismissing it. It's because whatever someone is telling me consciously, I know is not the problem. I have this saying that I always use, and I tell my patients, whatever you came in to see me for is not the problem. The problem is not the problem. You have to go at a much deeper level. So I want to be talking to the subconscious mind, because the subconscious mind is going to give me the answers. And whenever I think that consciously, that I think that, hey, this is what's going on here, when I start working with a person subconsciously, it never is. So I'd rather just bypass that and get right to the subconscious mind and, hey, the subconscious mind is going to tell me what's happening, and then we can resolve it.
Does it help, though, when a patient knows how to identify their emotions?
Absolutely. So the question is, does it help when a patient identifies their emotions? Yes, I love having patients who are extremely emotional, because what I do is I use those emotions to regress them back or follow them back into a previous time in their life, to the first event that caused those emotions to start up. So emotions are really good. Mm-hmm. Yes?
As a physician who's written a book about trauma and how it lands in the body,
yes,
causing disease, I really commend you for your work. And what I'm wondering is, having been medical director for clinics where the people that I worked with, the physicians were struggling really with answering 10 plus questions in a short amount of time, the quality metrics, the productivity standards, all of that. How do they create time to add this to provide quality health care?
Well, I'm not saying this is for every physician, first of all. Second of all, this is no more than a 20-minute office visit. So if they have existing patients in their office, or they're doing pre-op evaluations, and, from referrals that are being sent from the surgeons, that's an office visit they're getting anyway, right? So that's a comprehensive visit. And during that visit, they go ahead and they do the pre-op evaluation or any other comprehensive visit that they're doing. And then if they're finding that there's an issue with chronic pain, or if it's for a pre-op patient and they want to help the patient manage their pain post-operatively, then they can now get new visits out of that, from that patient, and be able to help that patient manage their pain more effectively. So I'm showing them how, or I'm showing any physician how to monetize this, and then also be able to implement in your patient care and improve, improve the quality of care of your patient and the quality of their life. Any other questions? Yes.
Yeah. So it sounds like this would work for more than just pain. Have you seen this? When you were speaking, it came to mind this could really work well for addictions or for other aspects of client care. Have you seen anything with hypnosis and addictions, or where can you expand beyond just pain?
Oh, I love that question.
Sure you repeat it.
Yeah. So the question was, can this expand into other types of problems that people have in life? And absolutely. I have patients or clients that call me from all over the world, and they fly me in, or they fly in to see me. And I work with all different types of illness, chronic illnesses, in addition to the chronic pain issues. And one of the things with pain is, usually when you have someone who has chronic pain, there usually is an addictive component. So sometimes we get people who are addicted to opioid narcotics and things like that. So yeah, it works with all types of different illnesses. Now that's a whole nother aspect in regards to how you have to manage those types of patients. It takes longer to work with people who have chronic illnesses such as multiple sclerosis or Parkinson's or Crohn's disease, etc. However, using hypnosis can be extremely effective. And like I mentioned, the American Medical Association, Psychological Association, etc., they all have recognized that hypnosis is a viable option for a lot of these people. And in some of those therapies, especially in Crohn's patients, people with irritable bowel disease and or inflammatory bowel disease and irritable bowel syndrome and stuff like that, those patients can actually have better results than the medications themselves. Okay, it's been shown in medical studies. Yes?
Dr. Allen, during the workshop, will you talk about the language that you use with patients? Because I can't imagine a patient walking in and saying, I'm going to hypnotize you. That's going to be very well received if they're looking for some kind of medical intervention. So how do you address that?
Yes, we'll get into that detail, you know, at the workshop, and I'll teach you actually how to speak to a patient and explain to them how hypnosis works and how the subconscious mind works and how the subconscious mind is playing a role in their illness or in their pain cycle. So in my workshops, what I love to do is teach, demo, exercise. Teach, demo, exercise. And we do this over and over and over for 3 days straight so that you will have it down. So when you leave this, you know, this workshop, you're going to be able to rock and roll as soon as you get to your office on Monday and start using this to help with patient care.
Quick one. Can what you're learning in your workshop be used online? Do you have to see people in person, or could you use this more in an online format, like
Telemedicine?
Yeah, like Skype video calls?
Yes.
Okay.
Yeah. Yes.
Have you ever had anybody you can't hypnotize? And the reason I ask is because I've never been able to be hypnotized.
Like I mentioned, everyone can be hypnotized. Some people take longer, or you have to use a different type of induction, and that's why I teach so many different types of rapid and instant inductions. And I'll be teaching you in the workshop on how to recognize what is the best induction for that particular client or patient that you're seeing at that time. The only patients or clients that cannot be hypnotized are people who cannot follow instructions, such as someone who's maybe severely autistic. But even those clients, there is an induction that I use that can help them. So I've worked with paranoid schizophrenics and autistic people, and I've used a very particular induction that I will teach you that you'll be able to hypnotize them to. All right, I think that's the end of our questions, and thank you very much. I really appreciate all your time.
Thank you.
Yeah.